Vaginal discharge. What is vaginal discharge syndrome? VDS refers to the abnormal discharges from the vagina characterized by changes in color, the odor and the amount or quantity of the vaginal secretions. It can cause discomfort and pain, and considerably impact on sexual functioning and self-image. It is usually one of the most common reasons for women to attend the health facilities. It is commonly caused by bacterial vaginosis, trichomonas infection and vulvovaginal candidiasis, which occurs most in women of reproductive age or childbearing age. Bacterial vaginosis is a polymicrobial disorder of the vaginal microbiome and is characterized by low concentrations or absence of lactobacilli. To a more diverse community of anaerobic and facultative bacteria with overgrowth of Gardnerella vaginalis. The main cause of the development of bacterial vaginosis lactobacilli play an important role in the maintenance of normal vaginal flora through the provision of the defense mechanisms via hydrogen peroxide production, and that is why lack of it results in abnormal vaginal discharges. Because of an increase in vaginal pH and amine production in bacterial vaginosis. Most women present with gray, thin and homogeneous vaginal discharges and vaginal odor. Most women have greenish-yellowish discharges due to Trichomonas vaginalis infection. Vulvovaginal candidiasis presents with intense vulval pruritus. A white curd-like, cheesy vaginal discharge. Causes. Etiology of vaginal discharge syndrome. Vaginal discharge syndrome is characterized by abnormal vaginal discharge, which can be caused by various infections. The common infections leading to this condition include bacterial vaginosis, BV, yeast infections, candidiasis, sexually transmitted infections, STIs, such as trichomoniasis, chlamydia, and gonorrhea. Infectious causes. 1. Bacterial vaginosis, BV. BV is caused by imbalance in the normal vaginal flora, where harmful anaerobic bacteria like Gardnerella vaginalis outnumber the beneficial lactobacilli. This leads to an increase in vaginal pH due to the decline of lactobacilli. The high pH creates a more favorable environment for anaerobic bacteria to thrive, and these bacteria produce volatile amines such as putrescine, which leads a fishy odor and thin, grayish-white discharge. 2. Yeast infections, candidiasis. Yeast infections are usually caused by an overgrowth of fungus candida, which is normally present in small amounts in the vagina. The candida overgrowth is usually caused by a broad spectrum of antibiotics that can kill beneficial bacteria such as lactobacilli, which keeps candida in normal levels. A decline in lactobacilli allows the yeast to proliferate. The discharge is thick and white. Patients usually complain with itching and erythema. 3. Sexually transmitted infections, STIs. Trichomoniasis is caused by the protozoan parasite Trichomonas vaginalis. This infection is transmitted through sexual contact with an infected person. Once the T. vaginalis is in the vagina, it multiplies and colonizes the mucosal surfaces. The presence of T. vaginalis triggers an immune response leading to the inflammation of vaginal mucosa. This is characterized by frothy, yellow-green discharge with a strong odor, itching and irritation. Risk factors. Risk factors of vaginal discharge syndrome. 1. Antibiotic use and abuse. Frequent use of antibiotics could eliminate the beneficial microflora in the vagina, lactobacillus, thereby promoting the growth of other organisms that are associated with vaginal. 2. Age. Younger age group, 21 and 30 years, the World Health Organization, WHO, reported that age less than 30 years. Active sexual life and multiple sexual partners are strongly linked to vaginal discharge due to sexually transmitted infections. 3. Douching. If the use of special substances other than water in washing the vagina. Douching distorts the vaginal ecosystem by destroying the protective lactobacilli, thereby encouraging the growth of other pathologic organisms. 4. Smoking. Research shows that nicotine content of cigarette smoke causes vasoocclusion by vasoconstriction of the vaginal microvasculature. thereby distorting the vaginal microflora and function. 5. Poor vaginal and anal hygiene. It is responsible for aerobic vaginitis in premenarcheal women. The organisms be transferred from the anal to the genital area, thereby causing vaginitis. The poor practice of cleaning the anus and or vagina from back to front has been identified as being responsible for the transfer of fecal organisms into the vagina. The organisms include Streptococcus, Staphylococcus, and Klebsiella. 6. Contraceptive use. The use of various contraceptive methods has also been associated with the complaints of vaginal discharge. Hormonal contraceptive methods with estrogen and progesterone content have been associated with increased episode of vaginal discharge. Estrogen plays a significant role in the proliferation of the squamous and secretory cells of the vaginal epithelium, while progesterone enhances the secretory content of the cells. 7. Previous contamination of pregnancy. 8. Tight-fitting clothing and nylon underwear. They create warm, humid environments which could promote growth of bacteria, hence possible cause of vaginal discharge syndrome. 9. Unprotected sexual intercourse. Semen deposited during sexual intercourse to the vagina can raise the vaginal pH because the semen is naturally alkaline. This pH change has been found to be toxic to the protective lactobacilli and could result in the growth of the offensive organisms leading to abnormal vaginal discharge. 12. Immunocompromised individuals, such as human AIDS-infected individuals due to weakened immune system mechanism, thereby reducing the immunologic activities of both the lymphocytes and neutrophils against the agents causing vaginal discharge. 13. Diabetes mellitus. Diabetes mellitus being a metabolic disease associated with derangement in glycogen storage and metabolism. The abnormal glycogen storage and metabolism in the vaginal epithelium is said to distort the lactobacilli function and normal vaginal pH. This change enhances the proliferation of agents associated with vaginal discharge. 14. Feminine products such as tampons, sprays, bubble bath, perfumes, tissue papers, pads, lotions and lubricants have been associated with vaginal discharge due to causing changes in the normal vaginal pH levels. 15. Other morbidities such as cervical polyps, cervical erosion, lichen planus, lichen sclerosus and cervical cancers are known causes of vaginal discharge. Treatment and prevention. Vaginal discharge syndrome treatment and prevention. Patient complains of vaginal discharge, dysuria or vulval itching, burning. Take history and examine external genitalia and bimanual. Use speculum. Abnormal discharge or vulval itching or burning. If yes, then start treatment. Treat with the following: ciprofloxacin 500 mg, doxycycline 100 mg 2x daily for 7 days, metronidazole 2g. In pregnancy, during breastfeeding, ceftriaxone 125 mg, erythromycin 500 mg for x daily for 7 days, metronidazole 2g. If vulval edema, curd-like discharge, erythema, excoriations present, add cotrimazole vaginal pessary 500 mg inserted. Ask patient to return in 7 days if symptoms persist. If symptoms persist, then refer for second level of care. Prevention measures for all patients: educate, ensure compliance, and counsel. Promote abstinence from penetrative sex during the course of treatment. Promote and demonstrate condom use, provide condoms. Stress the importance of partner treatment and issue one notification slip for each sexual partner. Follow up partner treatment during review visits. Promotive counseling and testing. For negative test results, repeat test after 3 months. Health education. Avoid douching, which might kill the beneficial bacteria that help prevent vaginal infections. Wear cotton underwear since it absorbs moisture and may prevent a yeast infection. Use barrier means of protection during sex, such as a condom, and having frequent STI testing. Use unscented soaps, tampons, and pads. As scented or strong products may disrupt the natural balance of bacteria in the vagina. After using the restroom, always wipe from front to back to prevent bacteria from getting into your vagina and causing an infection. Before contacting the vaginal area, wash your hands and dry them well to prevent introduction of microorganisms into the vagina. Urinate after intercourse to prevent a urinary tract infection. Take all of the medication exactly as directed. If you stop taking the medication before the infection is entirely gone, it may reappear. If you have been prescribed a vaginal cream, you should not use tampons while taking it. The tampons will absorb the cream. Do not engage in intercourse until your treatment is complete and you have no more evidence of infection. Inform your partner if the doctor believes the infection can be shared through sexual activity. This is really crucial because your partner may also require treatment.